Hi guys, and welcome back to our channel. Today we are here with Cecilia Fleming, who is a past KLR pharmacy technician student and is a certified pharmacy technician. Cecilia, thanks so much for being here today. We're really excited to hear about your experience.
Thank you. I'm glad to be here.
So tell me, you were an Excel Center student before you were a KLR student. So tell me about your time at the Excel Center, kind of what you experienced there, what Excel Center you went to, and also, Cecilia, what made you decide to take the pharmacy technician course?
Well, I went to the Excel Center because I have two kids and I felt like a hypocrite pushing them to do good in school when I didn't finish myself. So that was what initially took me to take myself back to school. My experience there it was pretty awesome. Like, everybody was really supportive, and like if you needed help, even if it was childcare, they were there for childcare. Extra help with the work, they were there. Guiding you in the right direction is really what they were there for. The whole pharmacy thing, I initially wanted to be a speech language pathologist, but that wasn't something that was offered. And the pharmacy tech was something that was explained to me, and I had always, I always liked medicine. I always thought it was really interesting, and so that's when I just agreed to do that, because I didn't want to be a nurse. I didn't want to stick anybody with a needle. I'm not okay with that.
Yeah, me either. Which year did you graduate, Cecilia? What year did you take my class?
Well, I graduated from your class in 2021.
Awesome. Okay.
Yeah.
So, gosh, I feel like it's only 2020. Well, I guess it's almost 2023, but I feel like that was so long ago.
Yeah.
Like,
it doesn't seem like it was as close as it
seems like
is.
forever ago. Yeah. So tell me about your experience at KLR. So the class looked, and be detailed here, because the class looked super different from what it does now to when you originally took the class.
Well, when I first took the class, it was your very, 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 very first ever pharmacy technician class. And you were in, I believe, Noblesville.
Yeah.
And we was watching it through Zoom. And then
you were in Anderson, right?
Yeah, the Anderson.
So we did, yeah. So guys, if you are watching this and you are a current or past student and you took the class online, we did not always start that way. So Cecilia took the very, very first class, and very first class ever. Is that right? That's so crazy. And I actually taught at the Noblesville Excel Center for Noblesville students, and on a big screen in everybody else's classroom and in my classroom were students from a couple of other schools. One was Anderson, which is where Cecilia was. And those students could, I think you could like barely hear me. You couldn't really see what I was doing. If I was
a lot of
on the board, it was like backwards. Yes, it was so hard. I remember like being right up in the screen, like trying to make sure you guys could hear me. And yeah, so it's changed so much.
Yeah.
So what else was your experience? Keep going. Sorry, I totally interrupted you.
I was very intimidated the first week of the class, but it wasn't as bad as it seemed. It's more of you got to just stay on it. You have to eat, sleep, and breathe pharmacy.
You do. So let's go back to that first class. We didn't use any computers. We didn't have Google Classroom.
Nope.
I don't even know that I gave you guys like assignments. Did I give you assignments?
Yeah,
we didn't give you assignments.
Yeah,
but they were like very few and far between assignments. Like, they weren't a lot of assignments, you guys. So for someone who's taking the class now where you're getting 13 assignments per class, it's kind of crazy. And that's 3 times a week. If you're not in this class yet and thinking about taking it, don't let that scare you away, because plenty of people have done it. But it just looks so different, right, Cecilia?
It does, yeah.
It has changed so much. Okay, keep going. Sorry.
I would say it changed for the better, honestly.
Yes, much more manageable.
That's really all I had to say. Was it was intimidating. It seems hard, but you have to give it your all, or it's going to be a lot harder than it needs to be.
So how did it go for you?
I had to really apply myself. I was one of the students that had a failed attempt, lost hope, and Katie called me one day and was like, listen, what would you do if this was your kid? Would you just say, it's okay, just try something else after all that hard work? So those words is what was like, you're right. I shouldn't
remember
give
that
up
conversation
yet because
well. Yes, I remember that conversation very well. And that's what you said. You're like, you're right. And it was the next term you came back and
passed.
we're super focused. I am literally, you were so focused. I was like blown away. You were a whole different person and you killed it that term. You did really well. So I assume you don't regret that decision to start over and come back, because
Definitely not.
where are you currently working, Cecilia? What's your title?
I'm a certified pharmacy tech at Riverview Health in Noblesville, Indiana.
Yes. Guys, if you are listening and you may have heard a video recently, we did an interview with Jade Simone, and she actually previously worked with Cecilia at Riverview. And I worked at Riverview as well. So I actually did not work there by the time you got there. I was already gone. So you came on, when did you come in?
February of this year.
Just this year? Really? I thought it was longer ago.
No.
So yeah, I left October 2020. So, but that's awesome. And let's really talk about, so I know your favorite position, but let's talk about your favorite position at the hospital. And I really want to hear what your day looks like in that position. And guys, if you have been watching these interviews and following along, make sure that you pay attention closely to this one, because Cecilia is going to talk about something we have yet to talk about in depth on this channel.
Well, before you go into the chemo, or not the chemo, I'm sorry, I'm thinking of the other room, the IV room. You log your pressures in all three rooms, your clean room, the IV room, and the chemo room, and the temperatures. You go in, you garb up from your dirtiest to cleanest. Then you wash your hands. Well, you put your booties on, you put your hairnet on, you wash your hands, and you put your gown on, and then you put the hand sanitizer on, and then you put your gloves on.
It's a whole process in the IV room. Yes, yes. But if you have been in this class or are currently in this class, you guys know that we've gone up from dirtiest to cleanest. You're always going to put those booties on first. Yep. So then what happens?
Then after I usually gown up first, and then I finish the rest of my pressures and my temperatures.
That's okay.
Then after that, I'll go to the computer, I'll log in, I'll see what needs to be made in the queue. I'll check the fridge for expired meds. After I've checked for expired meds and I get rid of them, dispose of them how I need to, I will print my batch, which is from, I believe it's 0600 to 1500. That's your first batch.
Yes. So let's talk about that for 1 second. Again, if you are currently taking this class, getting ready to take your national exam, comment below and tell me what her fridge temperature should be. What temperature range should a refrigerator be at? You guys should know this. And then also, what Cecilia just said is 0600 to what did you say?
1500.
1500. So in pharmacy, and a lot of times in most healthcare, they use military time. So comment below, let me know if you guys would like to see us implement that during class and kind of learn about that. And also if you even know what that is and what 1500 is. Go ahead.
I didn't when I first started, but I do now.
I remember starting at Riverview and being like, what are they talking about? Yeah.
Well, I'll print my batch. I'll make all the medications that's in that batch. They're patient-specific meds, so they're meds for patients that are in the hospital currently staying. Once I've got that batch done, I will go through the fridge and see what needs to be stocked. We have medications that have PAR levels that need to be at that PAR level to keep, like for the next shift.
Yep. Can you talk about a PAR level? What is that?
We have cefazolin syringes. We have 1 gram, 2 gram, and 3 grams. We have to keep the 10 gram or the 1 grams at least. I believe it's 10 in the fridge. The 2 grams is like 26, and at least 6 of the 3 grams.
Yep. So you guys, a PAR level is a specified number that you're going to keep on hand at all times. So just like if you're in your kitchen and you're like, we always want to have 2 gallons of milk, right? Yeah. That's your PAR level, 2 gallons of milk. So for medications, a lot of times in hospitals, especially IV medications, they'll say, we want to have these made up because they take a while to make, and we're going to go through them so quickly with these specific patients. We know that we're going to use this many a day. So we keep this many on hand so that we don't get behind. And that way also, if there's an emergency that comes up, an emergency medication that needs to be made, and this antibiotic comes up at the same time, you can throw the antibiotic right out because it's already made up, and you can focus on that real emergency medication.
Yep. The other medications that we deal with they're called like short stay medications. And those are always a little bit different than your like patient specific meds for the inpatient patients, because they're only there for a short period of time.
Yep, and that's why they're called short stay. So these patients, guys, for this CVSS, I think we call it, or short stay, are generally coming in for like smaller infusions that don't take as long. And Cecilia, correct me if I'm wrong. It's been a while since I've been at the hospital, but these are like iron infusions or different antibiotics, I believe, that they're coming in to get. And so they're at the hospital. We're going to treat them. We're going to give them their medications, but they're only there for a few hours.
Yeah.
Go ahead. Keep going.
I don't know what else you want me to say. I feel like that was, you do your cleaning. I'm trying to think back because I was IV today. So
let's talk about the cleaning in the IV room. What's that look like?
Well, you clean all your countertops. That's what the IV person does. We clean the countertops with Paradox. We let it sit for 3 to 5 minutes, and then we go back over it and clean it with alcohol.
Yep.
And then,
if you're a current student, tell me below what kind of alcohol we're cleaning with in a pharmacy. Go ahead, Cecilia.
I know what kind it is.
Yes, I know you know what kind it is. I'm quizzing people.
The floors and the trash is something that the chemo tech does. We split the cleaning, I would say. It's kind of splitting it. Trying to think, is there anything else?
Your hood.
At like 10:30, you may or may not have another batch that prints or that you need to print to do, because they might be due at like 4 o'clock or 6 o'clock.
Can you talk about the cleaning in the hood?
Like the box or
in the clean room? Yeah.
We don't have the box anymore. The box.
Oh, you don't? You guys got rid of the box. Okay.
Yes.
All right. Good to know. Well, what do you do in the regular room then? It's just the same cleaning. You're just cleaning the counters and all of that. That makes sense.
I don't do the walls. That's somebody else does the walls.
Yes, that's once a month. So guys, if you are a current student, I would like you to comment below also. There's all kinds of choices here, guys, today with this conversation. Comment below when she is cleaning a hood, any hood, what order do we clean in? What direction do we clean in? Okay, keep that in mind. Let's see what other questions. So Cecilia, before you started working in the IV room, you had to do what? What kind of test did you have to take?
The national certification.
Well, you had to take the national certification, but at the hospital, before you start working in the IV room, like really working in there by yourself, what did you have to do?
Oh, the compounding test.
Yes, the media fill testing and the fingertip test. If you guys are in a current class right now, or even a past student, how many times do you have to take that media fill test before you can compound sterile products on your own? That's a good one. And then do you work in the chemo room at all, Cecilia?
Yes,
you do work in the chemo
like
room.
that too.
You do? So the chemo room, obviously, is going to be different. You guys do have more of a glove box or hood in there. And again, if you are a current student, I'm loving this conversation. This is great review. I'm going to post this video straight to our class. If you're a current student, talk to me about in the comments, talk to me about what kind of medications are supposed to be made in let's reword that. Hazardous or chemotherapy medications are compounded in what type of laminar flow hood? What kind? Is it horizontal or vertical? Make sure you comment below and let me know. Let's talk about your trash cans. So all sharps go into, guys, puncture resistant container. If you don't know that, make sure you know it's on the national exam. But Cecilia, what color in the IV room are your trash cans?
You have 3.
So the one that your sharps go into.
It's red.
Red. But in the chemo room, it's different. What color is it in the chemo room?
Yellow.
Very good. Very good. So guys, those are also on the national exam. If you're a current student, and I keep saying this, but if you're a current student, you should have already known all this. We just took our midterm, so I know you guys know this is all chapter 1 material, but just reviewing, when you're hearing these conversations and these interviews, you should 100% be putting those things together. She's telling you real life things that she's using every day that you guys are currently learning. So that's really cool. Cecilia, what kind of things did you learn in class that you feel like you use often as a pharmacy technician?
Everything, like literally everything, and especially the math.
And room, yep.
And the SIG codes have been very helpful. Doing med history, they've been really helpful with doing the med history.
Yes.
I loved the SIG codes. I don't know why I liked doing them, but I did.
Everybody likes the SIG codes, yeah.
But it's definitely everything. Like I don't think there's anything that was taught to me that I have not used.
That is
at the hospital. So
that is so cool. What advice would you give to students taking this course, watching this video right now, heading into the pharmacy field, considering taking a pharmacy tech course and changing careers? What would you say to them?
I would say take it day by day. If it gets heavy, just take a deep breath, because it's not as heavy as you think. Give it your all. Be devoted to it. Don't get behind, because you get behind, you're going to feel like you're drowning. Katie is your biggest asset. She's going to be your biggest supporter. She's not going to let you fail. She wants you to succeed just as much as you do, if not a little bit more. That's really it. Like, just you have to give it your everything, or it's not going to go the way you want it to go.
Absolutely. I'm going to ask you one more question just to prove to these students that are currently in my class. So if you remember, we got to the part of class where you take all the notes on all the chapters within like a week. And that's a lot of notes. So would you say that those notes, that's what they just got to? So they're going to be taking hundreds of notes this week. Would you say that those notes in class were helpful?
Oh, yeah. Because you're not just reading it and hearing it, you're writing it down. So it's embedding it more into your brain. And you know a lot more than you think you do. Like, you're going to think you don't know something, and then you're going to go read it and you're going to be like, oh wait, I do know that, because it's not something you can just think of with the drop of a hat. You do know more than you think you do.
Absolutely. I agree. I feel like I tell people that all day long, every day. And I think it's so fun to watch students learn that they can do hard things. They know way more than they think they do. And the class just flies by. So if you are someone who's like struggling or thinking, oh my gosh, you can't do this, always remember it's a small amount of time and it's going to fly right by. So if you just stay focused, I think that it really just goes so fast, and you'll thank yourself. You'll be like Cecilia 2 years later, working at a great place with great management. I know Cecilia's direct supervisor very well. I worked with her. She's incredible. And you have so many opportunities as a pharmacy technician to learn and grow. So I just think that's a perfect example of that. Cecilia, thank you so much for taking the time out of your day to be here with us and talk to us about this. I know that the students will love this. I definitely am going to bump this so that students right now can hear it. I love to talk about the IV room and the opportunity to kind of ask those questions and get that, reeling through the students' brains. I think that's really cool. So thank you so much. It was nice to see you.
Thanks for having me. Nice to see you too. It's been a while.
Yes. You guys, if you have not yet subscribed to our channel, please make sure to do so. Hit the subscribe button. We do post almost every single week with new content, whether that be our top 200 drug videos, math practice videos, or interviews with past students. And we will talk to you next time with another interview. Thanks so much.